first state-of-the-art vaccine manufacturing facility has officially launched in Cape Town to help accelerate production in Africa. The initiative is a collaboration between government and NantSA, which is a division of NantWorks, founded by South African-born billionaire Dr. Patrick Soon-Shiong. President Cyril Ramaphosa says the hub will help address disparities, including vaccine apartheid.
The Covid-19 pandemic has revealed in many ways the extent of our continent's health challenges. The pandemic has revealed the huge disparities that exist within and between our countries on the continent with regard to access to quality health care, access to medicines, diagnostics and vaccines. And the challenge of access to vaccines was demonstrated manifold as we struggled right at the beginning of the vaccine availability challenge to access those vaccines when the Western world was hoarding those vaccines, and when they had ordered so many more billions of vaccines that they were not using but not making available to our African countries. At the same time, this pandemic has revealed the depth of scientific knowledge and the expertise and capacity of our continent.
Ramaphosa adds the plant is an opportunity for Africa to stand on its own when it comes to vaccine production.
Africa should no longer be the last in line to access vaccines against pandemics. Africa should no longer go cap in hand to the Western world, begging and begging for vaccines that they just want to drip off from their tables. We will stand on our own. This we are determined to do, and this facility is proof of that.
New research from Weill Cornell Medicine and the University of Oxford shows that even unrelated vaccines could help reduce the burden of the COVID-19 pandemic. These new findings suggest routine immunizations, that is, in combination with interventions including face masks, could potentially blunt ongoing COVID-19 waves while also preventing other diseases. Joining us for more on the subject tonight is Associate Professor of Population Health Sciences at Weill Cornell Medicine and lead author of the new paper, Dr. Nathaniel Hupert. Dr. Hupert, good evening to you, and thank you so much for your time tonight. Firstly, let's begin with the association between already existing vaccines and COVID-19, and just where did you, as scientists in the field, first make this connection?
So actually, this connection has been known for almost 100 years, and in recent decades, there's been a tremendous amount of data and analysis about how routine vaccinations have these what are called knock-on or heterologous effects, that a vaccination for one disease can essentially work out the immune system and help it prevent other viral diseases.
Let's talk about the suggestion that perhaps taking a flu shot or a measles shot could help ease the burden of COVID-19. Break it down for me in layman's terms. Effectively, how far would that protection go?
That's a great question. We think that it would go a little ways, but that little ways might be enough to make a big dent in some of the population waves that we see with COVID. We've got data from the pre-COVID era that says that these effects occur. We've actually now got a couple of years of data suggesting that, for example, as you mentioned, flu shots, when given, possibly reduce the risk of contracting COVID a little bit. When I say a little bit, I'm talking maybe 1 in 20 up to maybe 1 in 7. So we're talking 5 to 15% reduction in transmission. That doesn't sound like a lot, And yet, when we did these experiments looking at if we had tried to get primary care vaccinations out to the public in a widespread way, not just for older people, but covering a small proportion of the entire adult population, would it have an effect? What we found was it would have an effect, and interesting enough, its biggest effect is when those vaccines are given just as the COVID wave is starting to go up. So, for example, now with Omicron, most of South Africa is already beyond that curve, but there are many other parts of the country, including, parts of the world, including the United States and the UK, where we're still in the upswing. So what we're saying is, if you can take out 1 in 20 of those cases, it turns out that as those cases would have accelerated and multiplied, that small effect actually helps you do what people have been looking for, which is flatten the curve, reduce the caseload, maybe reduce the burden on hospitals. For example, the one where I work in Manhattan, in New York City, we saw incredible crushes of patients in prior waves. If we can lessen that even a little bit, we think that that would be a real benefit. And the best thing about this is that we're talking about vaccines that would be given out anyway. So not only flu, but also other vaccines, such as for polio, the BCG vaccine. These are all known to have these effects.
Some of these vaccines you're talking about are administered to a great deal of the population when we're still young, still kind of in the, pre-phase of the education, in the early stages, rather, of the education system. Does it mean that if you have been, let's say, vaccinated for polio as a youngster, you would still be covered today, or would you need to get another vaccine?
It's a very good question, and it's hard for us to find the right sort of the right metaphor for what's going on. I think a good one for thinking about the immune system, which is our body's system for fighting viruses and bacterial infections and other threats to our being, is that it's sort of like working out. That when you work out, your body gets stronger. If you don't work out for a while, the body doesn't lose everything. Maybe riding a bike is the best analogy. Once you learn how to ride a bike, it's hard to forget how to ride a bike, but you may not be as strong as if you were practicing riding the bike all of last week. These vaccines seem to have some long-term effects, and that's probably from a certain type of cell in the immune system that has a memory. But we've also seen that they also have some very short-term effects, so effects that only last a couple of months, which is why having a booster, say, or a flu vaccine, just as Omicron is starting, may actually give you more protection than if you had the flu vaccine last year. It may be that the body's reaction to the vaccine is part of what protects you. And it's an interesting thing that it's very rare for people to get 2 viral illnesses at the same time. People have studied this about flu and COVID, for example, and it seems that in good, large population studies, fewer than 2% of people are infected with both at the same time. And that's probably because the body's reaction to one helps you fight off the other.
So what does that mean, Dr. Hupert? Does that mean that effectively, if, post this research and going forward, the suggestion may be that perhaps people need to be vaccinated using other vaccines, and that will offer some kind of protection?
Actually, it's my hope that one specific thing comes out of this work, which is that the next time a pandemic rolls around, we don't switch off primary care. What we're saying is that everything that we do in primary care is not only important for people's health because it's primary care, but it may also be important for protecting against the pandemic because of the way that primary care delivered vaccines seem to have these indirect effects. One of the things that we saw globally is that when the focus shifted to COVID and lockdowns occurred in many countries, primary care interventions were left by the wayside because they were considered not important. What we're saying is these remain important and perhaps even more important now during a pandemic than and should not be considered simply secondary things that we can put on hold for a year. The other thing that I would say is with variants like the Omicron variant that seem to be very good at not being covered completely by existing vaccines, is that we should start thinking broadly about other things that we can do aside from all of what we call non-pharmaceutical interventions, the mask wearing, the social distancing, all of these things that are very difficult in terms of the running of society. We're saying these heterologous vaccine interventions might be considered part of that early and ongoing toolkit of things that might buy you not a tremendous amount of time. It's not going to make the pandemic go away, but it might buy you a little bit of time, at least, for example, until a large proportion of the population can get a COVID-specific vaccine.
Over the last 2 years, there's been, extensive data collected when it comes to COVID-19 and how it has affected people. Does, this research, does it check up against what we already know to have been the impact of COVID-19, including perhaps in those who would have been vaccinated for some of these other diseases?
It's a great question again. One of the things that we included in the paper was the emerging evidence that things like flu shots in places where they were given in relation to COVID surges seem to have a protective effect. There was a study of healthcare workers in Los Angeles, in California, in the United States, that showed that those who had had BCG vaccination, either in childhood or young adulthood, seemed to have a lower rate of symptomatic COVID. So much more of this data is going to emerge as we're able to sift through what occurred with COVID. But the early information that we received and that we were able to put into the paper and that we were able to use to convince what I have to admit were very skeptical reviewers, because this sounds pretty, outside the envelope. The data seems to support this. It seems to support a modest impact. So not the same impact, for example, of the specific vaccines by any means, but a modest additional impact in terms of preventing either symptomatic infection or transmission of the infection.
Associate Professor of Population Health Sciences, that is, of course, Professor Nathaniel Hupert joining us there. Thanks for your time tonight.